talking. Now, how about treatment? I know Tamiflu is out there. There are some cases that were maybe resistant, and then there are people in the English who really try and conserve their healthcare dollars. Said, well, Tamiflu shortens it up by half a day maybe, and maybe just having the symptoms are okay and will provide you with longer-term immunity. So if I'm a patient and I've been in a school where there's H1N1, should I go get tested? Should I just take my Tylenol and go to bed? What's the general recommendation? And then the other piece is, I've had it for 3 days. What are the things that make me go, no, I really should be going to the doctor now? I'm looking at my teenage daughter who's not getting up, who's not eating, who's not drinking. When should I go to the doctor? We don't want to flood the doctor's offices unnecessarily. So,
well, going back to the Tamiflu issue first, there are two reasons that we've been doing our best to kind of curtail the spread of this virus through our community, this fairly benign virus. One is the more humans it passes through, the more opportunity it has to mutate. The other thing is, the more that people use Tamiflu, the more opportunity that this virus, which is now very sensitive to Tamiflu, will develop resistance to it. So just as other things like school closure criteria have changed since this began in April of 2009, the indications for using Tamiflu by doctors has changed as well. We're not starting Tamiflu for the average case anymore. We're holding it in abeyance for people who have high-risk conditions. So if you had a patient with asthma and that patient developed the flu, that patient would warrant receiving Tamiflu. If the patient were pregnant and developed the flu, we would use Tamiflu in that patient. So we're limiting it a lot more. We're being more selective in its use. In terms of when to go to see a doctor, I think part of this is in how you and I, as physicians, deal with people over the phone. It's embodied in that. I will ask a patient after I hear about them, oh, my kid's vomiting and has diarrhea and hasn't moved in 3 days and is staring at and you hear all this stuff and you think this kid's on death's door. And you ask over the phone to the parent, now just tell me, is she sick or is she sick? And parents inevitably know the difference between the two, and people, in terms of colleagues, peers, know the difference between the two. And so some of these people that are described in this way, the dramatic way, are really just sick. They're not sick. And that's reassuring. What we're looking for is the population that's sick, if you're a normal person, or the population that has a high-risk condition, pregnancy, asthma, etc., who is just sick. Those are the kind of people that should be on the phone with or going to their doctors.
Is there any particular temperature we want to worry about more?
Not really, frankly. If you have a temperature of 102 or 103 or 104, but taking some Tylenol brings the temperature down and you feel a lot better, you feel good, you're doing fine, those people probably don't need to see a physician.
Yeah, certainly in my older kids, once they hit about 103, they start seeing giant ants from outer space, and once that temperature is down, they are back bouncing balloons around. But also, every degree of fever increases your fluid needs, and if you're in the middle of the desert, you need to drink more beer or Gatorade or something along that line. Now, if patients with influenza, though, and they are sick, should they go to their doctor's office, the emergency room?
I think it's a good idea to call your physician's office first and just enter into a discussion with the office, and they will perhaps manage things over the phone. They can give you some helpful suggestions, or they'll invite you to come in, and they'll tell you a way of coming in that's the safest way for the rest of the patients in their waiting room.
And then once patients are in the hospital, let's say they go to the emergency room and they are sick, they're going to be receiving intravenous fluids, and if they have sufficient pneumonia on chest x-ray or their oxygen level is low, they'll receive oxygen. Are there any kind of rescue therapies in the hospital Do the patients end up on ventilators?
Well, part of the reason that it's difficult to compare of influenza like swine flu today to a Spanish flu of 1918 is because we have these interventions you're talking about. There's the IV fluids. They didn't have IV fluids back then. There's oxygen that you can just give by a face mask or a nasal cannula. If people really get, if you get what's called a secondary bacterial infection of the lungs over the virus infection of the lungs, we have antibiotics today. We didn't have those in 1918. And then if you're really, really ill and you require intensive care unit attention, there's ventilators for you, and there's these very high-powered drugs that address your blood pressure problems. So it'll be hard to compare the deadliness of the virus given the capacity that we have to help people, even doing basic things today as compared to the past.
Well, Dr. Levin, thank you so much for enlightening us in so many different areas. This is an area where we really have to get moving quickly, getting immunized, and we'll make sure that everyone has information about that, making certain your doctor has information that's absolutely up to date, including watching CNN and maybe looking at their Twitter account. Mm-hmm. So Ventura, it's time for you to get moving out, get your flu shots, contact your physician appropriately. Don't clog up our emergency rooms if you're a little bit ill, but have a good medical home, somewhere you can call and get good advice. And if your child or your elder parent, anyone looks sicker than they should, get moving. Get to that hospital and get properly evaluated. Ventura County, get immunized. Come watch us on Get Moving TV.